We are live. Happy Sunday to you, Dr. Coffman.
Same to you, Allison. How are you doing?
I'm good. It's such a loaded question, right? There was, I think our last two Wednesday segments were perfect timing. If anyone watching right now missed it, we had the Eckerts on, and the first one was Kim Eckert talking about anxiety, and then we had Kim and Jeff talking about grief. And someone right after that sent me an article, and the title of it is, I'm sure it's gone through social media at this point, but how are you doing, right? Like one of the worst questions of the season, and how people don't know how to answer. At least they don't know how to answer authentically, right? And it's not like the old joke about like the old people, I should say older people, right? The 90-year-olds, how are you doing? Well, my back hurts and my psoriasis is acting up, right? It's like we say fine, but that sort of veils a whole deeper meaning of how are you doing? So thank you for asking.
Yeah, well, and you do. I've noticed people will ask, "What do you want? How do you want me to answer that?" You're like, no, I'm just being polite. Okay,
Right. Just say fantastic. Well, look, my father, even today, right? He loves the George Burns quotes. My dad will never say fine or good. He always says, "I'm doing fantastic" or "amazing." And then he quotes George Burns of blessed memory, right? And says, "Look, I read the obits every day and I haven't seen my name yet. So I must be doing pretty well," right?
Yes,
But look, I think we've gotten a lot of great questions through our Facebook page, and even anecdotally, I'm sure you're getting them. Well, you get them all the time because you're actually a licensed physician, unlike me, who's just having access to one, which
playing one on Facebook,
playing one on TV, right? But people are, I think the questions haven't stopped. I think now they're becoming even more, direct and specific, and also more complicated, because I think as we are seeing the lessening of the restrictions on social distancing, and as I say, the country is starting to swell a little bit and open up. It's just making people think, can we even plan, right? And the data, it depends where you look. The data is either really promising or potentially scary. What are you seeing in a sort of predictive manner? And not to say, sort of like we joked in our first broadcast about the meteorologist, right? To the best of our ability with the data and the information we have. What do you see like in the next few days, weeks, months ahead?
Yeah, and it is hard, and I think, like we've talked about all along, is that this is new and it's developing very rapidly, and then sometimes it seems like it's going really slowly. It's a weird kind of place to live in. And then I think as people do more, they're seeing just how much this is tapped into all aspects of their life. So we talked a couple of weeks ago about getting into summer programs and summer camps, and then just as we start to do things like go to our favorite store, think about eating in restaurants, there's a whole layer of things that come up. And I think some of the best advice I've been hearing is just to give yourself a break and give yourself a budget in regards to, as you add things back in, you just aren't going to be as efficient as you used to be. So things like hopping in a car and running at the spur of the moment to go do something may take a lot more thought and planning than it used to, which is frustrating. And then I think, as you try to do it with friends and family, there's a couple more layers of things you have to think about, which can be tiring, especially as you go through the whole day. And I think, take baby steps as we start to get in. You say, we want to go do this and think it through, and you go do it, and parts of it will be terrible. And you look back and you're like, that was the dumbest thing. And give yourself a break. You haven't tried to live with coronavirus and you're near coronavirus 19. And so I think, just those small bites. We've talked a lot about kids. And so, as you do new things with children, it's always difficult, especially the 3 and 4 year olds and the 12 to 15, 16, 35-year-olds. And I think especially as we look at those teens and tweens that we've talked about before, just take them baby steps as you give them responsibility. I think, what we've really tried to do is help our kids see a little beyond their own nose as far as what the consequences could be if something happened. So, if you're at the beach with your friends and you got sick and you had to stay there for 2 weeks, like, how would that affect our lives? Or if you got sick and I got sick from you, how would that affect me and my patients? And so I think just those slow conversations, giving them a little rope, letting them, give them some rules, let them go do it, and if they follow the rules, they've shown they can handle it and move forward. If they can't, reel them back in. So I think just those, as baby steps. Nationally, things are looking better. We're seing that the
Good.
new
Can we
case.
just stop there?
Yeah.
And that's all the time we have. So
Bye bye. See you next time. But we are starting to see some communities where things are kind of trending down. In Hamilton County, we're seeing an uptick. Some of that was happening before we loosened things up. I think we're expecting in the next week or so that we'll see, what is loosening things up. What's the impact on, on those things? And so we're going to put in our in the notes a couple places that you can go look. We've talked before about just how do we know what's going on, and we're starting to see better dashboards show up that you can look to. One of my favorites is a partnership between Stanford and George Washington University called COVIDact.org. COVID Act Now, COVIDACTNOW.org. And they post on there, they use 3 measures. One is the R0 value, which we can talk about more if you want to, which is just kind of how fast are people spreading it where you live. They look at the testing where you live, like what percentage of the tests are showing up positive. And so we feel like if you're doing enough testing, the rate should be about 2%. And like in Hamilton County, it's 4 right now. So it's a lot higher than it should be. And then it's also looking at hospital usage, and especially ICUs. And so that website is using those 3 factors to give you either a green, yellow, or red rating for where you live. So Tennessee is yellow, but Hamilton County is red. And so in a place that's green, you could pretty much go out and do your normal routine. Yellow, you need to be very strict about wearing your mask and being careful with common surfaces, social distancing, good hygiene, washing your hands a lot. Red is a place that we should be extremely careful. So kind of dialing things back even more.
But what about like us, right? Like I've always bragged about the fact that in 3 minutes or 5 miles, I can be in 2 different states. So close to Alabama, where I grew up, and then over the border to Georgia, where my sister lives, right? And have dear friends and family. But that also comes with sort of some perils now, because we can't just be insulated. It's not just like I live in Hamilton County and I can't expect anybody else to sort of infiltrate, especially a city like Chattanooga that is a mega tourist destination, even in regular times or pre-COVID times. I would imagine this summer it will be, we hope, a hotbed of activity from people all over, especially those who don't want to get on an airplane this summer or looking for a distance to drive, considering we're in a hour to 2 hour drive of so many cities in the Southeast. How do we navigate that, where it's not just the color of our city, but the color of other people coming from cities we probably can't even imagine?
Yeah, well, I think that's where it helps to kind of be able to watch what's going on in Nashville and Atlanta specifically, because both of those are international communities where you have people coming in and out. And right now travel is lower, which helps. But as that starts to get back to some kind of normal, that will impact that as well. In Tennessee, and we talked about this a little last week, but what we're seeing right now are 3 types of outbreaks. So we're not seeing a lot of person-to-person transmission, like you go to the grocery store and you picked it up from someone in the grocery store. We're seeing institutional outbreaks. So like at Bledsoe County Correctional Facility, where we had over almost 600 cases. We had Life Care of Athens. We had Orange Grove, where someone infects a close institution like that and it kind of spreads. We're seeing workplace outbreaks. So like at the chicken processing plant in Chattanooga, there were 11 employees there that got sick from one of the employees. And then they actually tested their families, and there was a total of 41 people that tested positive in that family cohort with those employees. And then we're seeing neighborhoods. So like the cul-de-sac where it's spreading amongst families. And the thought there is that, like with children getting it and playing together, is where that's going to pop up. And so as we look at opening daycares and as we look to opening schools, I think that's where that local county evaluation of, is this green, yellow, red? I think that's going to get a lot more detailed over the summer. And looking at right now where Hamilton County, the spread rate that are not it. So what that means is if I have it, how many people did I give it to? And so, and they're using 1.2 as kind of if it's above that. So if one person gives it to 1.2 other people, that's a place where it's regards to what most of the and the hard part is no one is following any of the recommendations in regards to communities. But if that R naught gets below 1 for 2 weeks, then it's relatively safe to start thinking about doing daycare. And so I've been telling people, right now, if you have to go back to work, you have to take your kids to daycare. And daycares in Chattanooga are doing a lot of stuff to try to mitigate spread in regards to not letting parents in and staggering arrival times and making sure everyone is sterilized as much as possible when they get there, and decreasing class size and spacing them out, adding more people. So they're working really hard to make that well. But if you don't have to, when we're in this red and then red zone that we're in right now, it's if you can wait a week too, that it probably will be better.
Yeah. Look, a lot of the discussion I have with my friends and also our kids is this idea of sheltering in place being a privilege. And it just is. Mm-hmm. And I know many of us are very concerned about the fact, and you talked about it, right, that there are certain zip codes that proportionately have way more cases than the rest of our county, and that we're seeing the inequities that existed in those marginalized communities, right, and minority communities before COVID have just been exacerbated now, right? So it's easy enough for me to say, oh, daycare, it might not be safe to open. My kids are grown and can drive, so that's not an issue for me. But to your point, if people, and they do, like, people have got to go back to work soon if they haven't gone already. People need daycare. There's a lot of single parents out there who maybe don't even have extended family they can rely on if they have to, or neighbors. So, hearing that there are at least precautions that the daycares are putting into place is also very comforting and very necessary.
Right. And I think, and so many people live in situations where you have close quarters. And in our region, we have families that share very close quarters, and that makes it so much harder. So I can flippantly say, well, if you're running a fever, you probably ought to isolate yourself in your home, and so people don't have a place to do that. And so what are we talking about? And I think the city of Chattanooga has done a great job in providing resources for those who are in those kind of difficult situations to have a place to do that. And fortunately, our rates have been fairly low enough that we've been able to provide those things. Locally, as you look at the data, I think everybody gets fired up about the new cases, and so we'll have days where there's 2 new cases, and we have a day last week where there were 41 new cases, and so it gives you a little bit of a neck pain because you're trying to figure out, like, what's going on here, and I think it's because we're going to have these episodic little outbreaks where we'll have big numbers of testing that pop up. The testing rate is actually going down in Chattanooga. So this last 7 days, we're down about 25% in the rate of testing. So a lot of people are talking about, well, the caseload going up, it's because there's more testing. That's not really true in Chattanooga right now. And then I think the other part that I would encourage people to look at is the number of people that are hospitalized right now. So we're running about 14, I think was the last number I saw, of people that are hospitalized. And that will that is a late number. So that's going to show up. Cases are going to be further along, that they're at a point that they need to be hospitalized. And so when you're looking at that number, that's probably a 7 to 14 day number in regards to what's happening in our community right now. Whereas new testing is going to be a kind of before that. I think the thing to give people hope is there's so much work that's going on right now. When I was finishing up high school, starting college, is when retroviruses and HIV showed up. And I think, it was very interesting because I went to so many talks where people would talk about, the only people that get this are homosexuals and Haitians. And same kind of thing. I think, I hear people talking about, well, if they just practice better hygiene, or if they follow the rules, they wouldn't get this. And, this is something that, you do the best you can, but we can't blame ourselves if, we get sick, or if our children get sick, or our parents get sick.
Right.
And I think as a community, we need to make sure that we're there to take care of each other. And that whole process of kind of understanding the HIV and AIDS, which is the kind of the clinical, the symptoms of the HIV virus, that work took 10 or 15 years, and then we've spent the last 10 years working on a vaccine unsuccessfully because HIV mutates so fast. And so a lot of that work that when I was in college and graduate school, looking at, watching all that very closely, that work that took a decade has been happening in like 3 or 4 months with coronavirus.
Right.
So, and we were prompted, when you hear people talk about this is unprecedented, it's never happened before, that's not really true. In 2003, we had SARS, which is a coronavirus, just like coronavirus 19. In fact, it's SARS-2 is the term for coronavirus 19. So we knew some stuff, but with the advent of a lot of the understanding of viruses that we've gotten from HIV, with all that's gone into recombinant vaccines, and being able to generate vaccines to specific proteins, and then all the work that's happened with immune diseases and cancer around monoclonal antibody therapy. So a lot of the medicines that people take for Crohn's disease or ulcerative colitis, or a lot of medicines that you see used for cancer, where we take a protein that's on a cancer cell and we develop medicines specifically for that. All of that technology has been poured out. I mean, the whole planet is working on developing ways to fight coronavirus. And I think, as you hear people talk about the coronavirus, the spike proteins, if you see the cartoons and pictures, those are all the little things that are sticking out of the circle. I imagine Halloween spike proteins are going to be a big seller as we get into it.
It's a big costume, yeah.
Yes, but that protein, we know that thing has been dissected, and they're developing monoclonal therapies directed specifically at that. That's what some of the vaccines specifically look at. There's over 100 different vaccines that have been kind of devised. They've been looking at what they think is the best. They're down to about 14. They're actually going to act like, what typically happens is you get a vaccine idea and then you kind of build it out, you test it, you see how it works, you go to kind of second round of testing, and then you do a long extended trial. So like with chickenpox vaccine, the varicella vaccine, that was a 10-year process going from concept to effective vaccine. And so what they're doing with coronavirus is trying to do all that at once. And even to the point of, we'll probably get in the next month or two, some idea of 4 or 5 different vaccines, and they're going to act like those things work, and they're going to build out the whole production line, not knowing that if it's going to work or not, because the testing is going on, so that once we start to have some good testing results looking at safety and efficacy, then they're already going to have the production ready to build, hundreds of thousands of doses. So we've never seen anything like this. It really is unprecedented. And then I think the other thing in regards to vaccines, you hear people talk about, there's a lot of talk just this weekend. I was watching some of the news shows this morning and talking about, by the end of this calendar year, even as fast as we're going, it's probably going to be 12 months. It might be more like 18 months. And then most of the people in vaccines are saying it's probably going to be more like 4 years. And what it'll look like is, some vaccines that work okay, but kind of, aren't the best. They're safe, but they're not as effective as they could be. And then we'll see better and better vaccines, similar to what we've seen with meningitis production. And then I think the other thing we're going to see is a lot of treatment for coronavirus. So remdesivir is an antiviral that you may have heard a lot about, and then hydroxychloroquine is an anti-inflammatory medicine that people have heard a lot about. What hydrochloroquine does is it actually affects how our own cells take up the coronavirus and interferes with that. And everybody was very excited about that possibility. But what we're seeing now is that there's probably, in folks that are sick with coronavirus, there's some side effects that make it probably not the best therapy. But with remdesivir, that's an antiviral that was developed with some of the HIV work and has been repurposed and shows some promise in inhibiting how coronavirus replicates. And so as we get toward the end of this calendar year, I imagine that we'll have some early therapies that, when you get sick with coronavirus, that they can treat. Right now, it really is just supportive care, which is very frustrating. And I think, like we saw with HIV, where the first 5, 6, 7 years, it really was a death sentence for those that got it.
Yeah.
Now you can get HIV and have, really, live your whole life and have unmeasurable amounts of the virus in your system. So I think we're going to see that progression with treatment pretty quickly, and that's going to have a huge impact on just how we do. Because if it's not as if you don't get as sick, if we're not seeing the complications, then allowing folks to kind of I guess being more laid back about people getting it,
Right.
that's when that will show up.
I will just speak for a lot of people in saying, if I am quarantined with my family until the end of 2020, I'm going to need more than just vaccine therapies to get me through 2021. So that I'm going to take this one step at a time. Also, since we're, I sometimes forget we're Facebook Live, but I wanted you to see that Roger and Milbury are watching. Amelia and Michael say hello, and April says hello. So if you have questions, we love for you to post. We love that you posted there. And I was going to, back to the HIV analogy. I was talking to our friend Kathleen, who was in residency around the same time you were, and she says she remembers she was learning to draw blood on patients without using gloves, right? Mm-hmm. So how time has changed and evolved, and the practices we use. We say the same analogy before 9/11, right? Being able to walk your friend or your spouse or your partner to the gate at an airport, which is of such a lost formality that we can't do. Since we have oh, sorry, go ahead.
Well, I was gonna say, I was even telling Joanne, my wife, I've been wearing goggles and a N95 mask and gloving, and I was thinking I might not go back to not wearing those, because, just in hanging out with kids, I mean, so many times I get sneezed in the face, or somebody would cough right in my mouth, or you get the sweet hand right in the mouth. And I was like, I don't think I want to go back to that after.
Right. You're like, I'm done. All right. So I'm going to use this. I'm going to do a new part of our segment. I'm going to call it quick fire, because I know we've gotten a lot of questions. You're getting questions, and I'm getting questions, knowing that I will have direct access to you. So we'll do, it may not have a quick answer, but as quick as we can. Okay. Number one is antibody testing. Should people get it? And if they should, who are the they? What are the requirements to get an antibody test?
So antibody test is not going to help an individual at all. Most of those tests are not great at the moment. In fact, we don't really know, how sensitive they are. Antibody tests right now are being used in large population studies. So they're like, how many people in Tennessee have been exposed and developed antibodies? Even if you have antibodies, we don't know how protective they are. So as an individual, saying like, if it's positive, can I go back to work? We don't know. If it's negative, was I exposed? We don't know. So it's not useful for general population right now.
Okay. I know we keep referencing the rate of people infected, but I also hear people then counter that with the death rate and saying that rate has pretty much stayed stagnant. Is that a valid sort of counterbalance to the fact that the numbers, we say, well, with more testing, we're going to know more people are sick, but not a lot more people have died. Is that taken into account? How do you factor that?
So I think, the sample size in our local market, so we went to 10 really fast. I mean, our data looked terrible. Like what are we doing here, that this is how bad our mortality is? And so I think so much of that in our small sample size of our community was just kind of random chance. The fact that we've leveled off, I think, is probably random chance, and our local institutions getting much better at managing what's going on, because I think there is a lot to learn in regards to just how you handle patients and management. And when we first started all this, the things we were doing in regards to early ventilation, all that's changed pretty rapidly. And so I think, hats off to Park Ridge and Memorial and Erlanger from learning from what's been going on, especially in New York City and in France and Italy and Spain. And then I think, there are a lot of things that are popping up in regards to treatment. So that has been varying. I think at this point, what I would look to as far as the real measure of how much we're having here locally is how many people are hospitalized with the diagnosis. If you go back and look at our original data, there was a huge band that was like people under observation. And that was because it was taking 6, 7, 8 days to get results back. And now for an inpatient, they're getting results back sometimes as short as 4 hours, but usually within 24 hours. So I think you can pretty much look at that, and they're publishing that on the Hamilton County Health Department website that you can keep an eye on.
Okay. And also sort of with this new normal, and as we start to socially interact after being socially distanced for so long, it's bringing up stressful situations that were never stressful before. So one stressful situation I encountered personally, I went to my well visit and I got into a very small elevator because I figure it's either the elevator or go upstairs, and it's 6 in one, half dozen, fears in another, and then 3 other people got on the elevator with me. I had on a mask. They all had on masks. They were actually, 2 were RNs, and I see their badges. What do you do in an elevator situation? Should I have gotten off the elevator, somehow waited for an empty one? Do I ask the people who get on after me, if they would wait? I'm not sure what social etiquette dictates.
Mm-hmm. So the other thing, it's small enough that I would consider the walls as dirty as the floor.
Right.
And so you don't want to lean against the wall or, put your hand up on the wall. After mass, the biggest branded thing now are the little kind of things you could attach to your keychain so you can push elevator buttons and those kind of things. But just realizing that I'm touching surfaces that have a high likelihood of being contaminated. If everybody on the elevator is wearing a mask, that helps a ton.
Okay.
And then places where I think, you're seeing high frequency. So in New York City now, they have, it's a 2-person occupancy on most of the high-rise elevators. And I think, here locally, the rates are not high enough that, I would be too concerned being on those, but I just would be careful with the surfaces in the elevator.
Oh, and I didn't touch that button. I know better than that. I'm not. And I also just bought 10 of those metal antimicrobial. I don't even know.
Yes, there you go.
They sold it. A friend of mine's making them in California, and it also is like a can opener. So I figured that was kind of good. Last is someone just posted this today on social media, and I've had this experience as well. How do we, politely, respectfully tell somebody they're too close to us, right? When I was going into WTCI at the very beginning of this, we were doing a show with the school system, and the president of our station, he was great. He said, he told all of us, he said, if you feel someone is too close in your space right now, just yell "Space Invader," right? And it was a quick way to do it. And we all knew that was the code and the cue. But when I see a person in public or at Publix, right, or at Costco, and I don't know these people, is it, and I don't have time to really, navigate away from them, which would be my preference. Have you figured out how to politely, say to someone, keep your distance without causing some COVID rage, as I call it?
Yeah, well, and I think, I'd say, I'm really sorry. I don't mean to offend you, but I'm not comfortable with how close you are to me. Could you please move back a little bit? And some people just are excited talking, and they're not paying attention. Right. I got really frustrated Friday night. I went to pick up food at a restaurant, and there was a bazillion people standing in the little 7x7 entryway. And I just told them I'm a pediatrician and I've been around people with coronavirus, and I was quickly allowed to have my space. So that worked really well. Anybody can use that. I'll back you up.
I'm so using that.
That works well. People pay attention to that one.
All right. I'm just going to get a picture of you on a badge and go, sorry, I'm with Dr. Coffman. Spread. Space Invader. Space Invader.
I talk to him twice a week. About
we're best friends. You need to with me. All right. Well, this is, as always, very helpful. And it gives me, as a parent, as the two of us, and our spouses are navigating the new normal of parenting, right? And that reward risk balance that we talked about at the beginning is something, I thought it was difficult before. It's even harder now. I mean, I told you our 20-year-old is now out in Montana. We thought, as he's still doing online college, and went out with a friend. Apparently there are more cows living in Montana than people. I thought that's a good place to quarantine with one of his best friends. And now I can think of as, well, great, if he gets sick, I don't know. I hope the hospitals in Bozeman are pretty decent. So there you go.
Well, and finishing up one quick story with so Milbury and Roger are my parents, and when I was in his age, the way my dad communicated hard things to me is he would write an article in the church bulletin about whatever he was worried about, for me. And then the church his secretary at college, I would get the church bulletin in the mail, randomly, and I'd open it up, and of course, so that's how I learned from my dad. And so it's so nice that I can turn around and kind of give them the things I'm worried about with them via Facebook, and they can be present. So, it's a nice, I feel like we've completed the circle now, but.
I love it. Well, and in case nobody caught the very subtle subliminal messaging in the back of my screen, I have the face mask on the little happy icon with the heart eyes. So wear your face mask in public. It protects not just you, it protects the people around you that you love, that you know, and those that you don't know. And it shows that we have a greater, kinder, more patient, respectful society. I am, as always, grateful for you, Dr. Coffman, for sharing your experience and expertise with us in such a candid way that just always brings me comfort. So thank you so much.
Oh, you're welcome, Alison. It's always good to talk to you.
And then Wednesday, we have Dr. Jeff Eckert on the show again, right?
Yes, and he will be answering that question that we're all asking privately: how much wine is too much wine?
I don't want to hear the answer. La, 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 la. I can't hear you. I love it. Well, I'll see you and talk to you Wednesday at 12:30 Eastern. And to everybody viewing this, we hope you stay safe, happy, and healthy always.
I'll see you, Allison. Thanks.
All right, bye.